are children facing this disease, and what can parents do to lower the risk and make sure their children are living a healthier life? Dr. Salim Surani joins us live to discuss. Dr. Surani, good morning to you. Thank you for being with us. So why are more kids getting diabetes now?
So first of all, you need to look at it. What is the incidence right now? I think this was a very good study done by Wake Forest Institute and they published in Lancet. On an average, if you take the diabetes type 1, it is increasing 6%, 2% in diabetes type 1 and 6% in type 2. And if we take 2060, fast forward, the incidence of type 2 diabetes among children will increase by 700% and type 1 by 65%. Why is that so? I think there are two factors. If you take type 1, again, the autoimmune process, the genetic process, and even the COVID-19 has something to do with that, because we know that it can go into the pancreas and kind of destroy that. But again, type 2 diabetes, what we have seen some disparity more in the African American and Hispanic population. You have a sedentary lifestyle. Nowadays, nobody goes outside, so they are not exercising. If you're not going outside, you're not getting vitamin D, and you just mentioned vitamin D plays a very important role in the glucose homeostasis. Then on the other hand, the dietary factor, not only we are not going out, not exercising, our dietary factor is not that good. We like the burger, we like the French fries and going out in the McDonald's. So I think those are the things which we need to watch, we need to use in moderation, and we need to exercise. On the other hand, the genetic factor, the race factor, going out in the sunlight, getting some vitamin D, all of those things are going to help and try to help decrease the incidence of diabetes among children, because it's a very concerning. If you're talking about 2 and 6% every year and 700% increase by 2060, we have a problem at our hand.
We definitely do. Now, with the children that have diabetes, do they have to follow a diabetic diet?
Yes, depending on that, whether you have a type 1 diabetes or type 2, regardless, I think you need to watch the diet very carefully. And that can be very, very challenging among the children. So, you know, even as an adult, if you have a birthday, you want to go out and have a cake and ice cream, but moderation is a key thing. And there is always a plan where you can have some portion of the carb in your meal. But on the other hand, the legislatures and the healthcare need to start doing more research into it. What is the genetic factor? How we can modify that? Because now there are a lot of technology where we can alter and go inside the gene and try to help prevent type 1, which is genetically mediated.
And it's important to talk to your kids, explain what diabetes is the best way possible, and explain why they have to eat a little different and why it's best to eat healthier and move around. Thank you so much, Dr. Surani, for being with us. If you have a question for Dr. Surani, all you have to do is text it to the number on your screen. That is 361-855-6397.